Hi, my name is Dr. Neil Schusterman, and I head up pharmacovigilance and risk management at Endo Pharmaceuticals. I'd like to tell you about the recognition and reporting of adverse events and product complaints, and the role that each Endo employee plays in this process. In this presentation, I will be referring to adverse events as AEs and product complaints as PCs. AE and PC recognition and reporting is a company-wide requirement for all Endo employees and contractors. You may come across AEs and PCs about Endo pharmaceutical products, whether branded or generic, in different settings, on the job, through popular material that you read, such as newspapers or websites, or through casual conversations with people you meet at work or outside of work. Regardless of the setting or the source, if you recognize an AE or PC during the use of an Endo pharmaceutical product, you are required to report it. The purpose of today's session is to accomplish 5 training objectives. Describe why AE-PC reporting is important. Define an AE and PC. Outline each employee's responsibility. Describe the consequences of noncompliance. Describe the correct reporting procedure. Why do we report AEs and PCs? We report AEs and PCs primarily to protect both our patients and our products. Patient safety is paramount, but we also need to capture AEs and PCs so that we have a better understanding of what is happening with our products. By properly reporting AEs and PCs, we remain in compliance with various policies and regulations such as good clinical practice, regulatory requirements, and company policies. What is an AE? It is any undesirable experience associated with the use of a drug in humans, regardless of the relationship to that drug. It can occur either during or after exposure to the drug. Notice the 4 main components of an AE. First, it needs to be an undesirable experience, something the drug does that is unwanted. Second, it occurs in a person. An event that occurs in an animal is not relevant. Third, it occurs only while the drug is being taken or afterwards. An event that occurs before a drug is taken cannot be an AE. Fourth, regardless of whether you believe there was a relationship between the drug and the event, it is still an AE. In other words, whether you believe the drug caused the event or not, it doesn't matter. An undesirable experience might be a sign or a symptom. What is the difference? A symptom is something that is felt by a person and reported, such as a headache, stomach pain, or blurry vision. It can also be an expression of a mood, such as I feel sad or I feel depressed. In other words, it is described by a patient. On the other hand, a sign is something that can be seen or measured, usually by a health professional. An abnormally elevated blood pressure, or an abnormal lab result, or a finding on an X-ray would be signs. Sometimes it's even simpler. A skin rash would be a sign because it's observed. Whether the undesirable experience is a sign or a symptom, it is regarded as an AE. Does it matter whether you expect the drug to cause the sign or symptom? No. Regardless of whether you would expect such a finding or not, it still needs to be reported. As an example, certain drugs might be known to cause nausea, like Percocet, but that doesn't matter. If you hear about such an event, even though you might expect the drug to cause it, it still needs to be reported. Now, AEs can occur in various settings. For example, a patient may experience one while taking a drug, or a healthcare professional may observe one in a patient in her practice. Again, it doesn't matter who observes it or where it occurs, it needs to be reported. Some types of events are automatically reportable because the regulations say you must. These include a congenital anomaly or birth defect if the mother was exposed to a drug. Others include a drug overdose, drug abuse, and drug withdrawal. Because of the many pain products that Endo markets, these types of events are especially important to us. Finally, even though you might not think of it as an undesirable effect, if the drug doesn't work as intended, it needs to be reported. We call this lack of effect or lack of efficacy. In the beginning, we also mentioned product complaints, or PCs. What is a PC? A PC is any report of dissatisfaction with the quality of an endo product. It encompasses several obvious issues and some not so obvious issues. A problem with product effectiveness or lack of effect is always considered both an AE and a PC. That's because there might have been a problem with that particular batch of pills. However, as a reporter, you would only need to report it one time. The medical information group at Endo, who takes the information, will make sure it is shared with the appropriate departments at Endo, such as pharmacovigilance and quality assurance. Other PCs include problems with product integrity, the seal on a bottle is broken when it shouldn't be, labeling, the label is misprinted or provides inaccurate information, packaging, the bottle is dented or damaged. There are too few or too many pills in a bottle. The wrong tablets are in a bottle. These are just a few examples. If there is something wrong with something we sell, then it represents a product complaint. It's important to remember that all Endo employees and contractors are under an obligation to report AEs and PCs. What can happen if we fail to do so? Well, Endo can be issued a deficiency notice called a Form 483 if it's discovered that we failed to report AEs and PCs. A Form 483 is a list of items that the FDA believes deviate from regulations observed during an inspection. It requires the company to provide a written response and to put in place a correction plan. If the violations are severe enough, there could be legal consequences for the company and/or an employee. Failure to report could subject an individual to disciplinary action up to and including dismissal. What kind of information do you need in order to report an AE or PC? In general, you need 4 pieces of information. An identifiable patient, which means you have at least some idea if it's a male or a female, or an age, or something similar. An identifiable reporter. The patient told you, or a family member told you, or you heard it from a healthcare provider. An endo suspect product, which you can find from our website. Remember, if it's not our product, you don't have a duty to report it. And an adverse event, which I defined earlier in this presentation. But rather than worry if you have all of the information or not, it's easier to report an event even if you only have partial information. If you're missing one of the elements, don't fret about getting the rest, just report it. The pharmacovigilance or quality assurance departments will do the rest, and you have properly discharged your duty. How do you report an AE or PC? Reporting is easy. Just dial 1-800-462-3636 from any phone. It's important to remember to report the AE or PC within 1 business day of becoming aware of the information. We have regulatory reporting obligations that must occur within certain timelines, and the regulatory clock starts ticking as soon as someone in the company becomes aware of an AE or PC. Again, if you have any doubt about whether it's a reportable event or not, it's safer to report it and let our pharmacovigilance and quality departments sort it out. Now let's discuss particular situations you might encounter. First, what if you hear of an AE or PC verbally? For example, you are attending a social event and you hear someone saying they took one of our products and had an AE or PC. Then you have an obligation to report. All you do if you hear an AE or PC in a conversation is call the 1-800 number within 1 business day. Our medical information department will take down the information and provide you with a tracking number as an acknowledgement that you reported this event. You may then save that for your own records. If you happen to be reading the newspaper, a magazine, or any other printed communication, and come across an article about an adverse event happening to someone who took one of our products, that must be called into the 1-800 number within 1 business day of reading the article. Again, the information will be taken over the phone, and you will be provided with a tracking number. Sign your name and date the document, and write the tracking number on the hard copy. Place the signed, dated, written matter with the tracking number in an envelope and mail it to Endo at our address shown here. The same rules apply to email. For example, if your sister emails you to say she started taking butalbital for her migraines and it made her sick, call in the information to the 1-800 number. Again, the information will be taken over the phone and you will be sent a tracking number. Attach the email confirmation with the tracking number to the email describing the AE or PC and forward that information to the email address shown here, safety@endo.com. I hope you have found this information helpful and understand your important role in reporting AEs and PCs that might occur with our products. If you ever have any questions, don't hesitate to contact the Pharmacovigilance Department at our email address, safety@endo.com, or the Quality Assurance Department at productcomplaints@endo.com. Let's keep our patients, our people, and our company safe.